17-month-old Issa is severely malnourished and close to death.
يجي 10 شهور.
10.
ضرش، اسهال، انتفاخ، تقية، قلق، نعالج ما توقف المرض هذا. أعطيناها أنا نجي 10 أيام. أكيد بنهتم بك قوي إنه ولدك ما تسوي، بنهتم بأشد الاهتمام والله، يعني لا بننام لا ليل ولا نهار. إيش نسوي؟ عورها يعني حزينة قوي، سهر لا بننام لا ليل ولا نهار بكوا. قاعدة يعني تعبة عندي جدا والله، ما يعلم الله، يعني تعبة قوي.
Doctors say Issa is now in a coma and he needs to be in the intensive care unit. But to get into the ICU here, you have to pay. And Issa's family just doesn't have the money.
Mother can pay the money here in the ICU, can get Issa inside her or cannot. If cannot, sit in the emergency room.
So if they can't pay, they can't come in
Cannot pay, cannot accept the case here.
Little Imtiaz is 2, but is so acutely malnourished she weighs as much as some newborns. A chest infection has now left her gasping for breath. Her grandma says all they've had at home recently is tea and bread. Imtiaz is in desperate need of a ventilator, which they don't have here in emergency.
يا محمد كلمة الدكتور على أساس يحولوا العناية المركزة.
عناية بس العجوز ما رضيت، ما فيش معاه.
ما فيش فلوس.
تدري إيش المشكلة؟ إيش المشكلة؟ ليش ما تحولي أمس؟
ليش ما تحولوا العناية المركزة؟
أمس فعلوا له الشفت لا داخل.
أنا صار جد هاي دور زلط.
عادي صار يدور زلط.
حولوا
دقيقة 5 minutes عشان في فلوس، ما فيش فلوس هذا بس نجيب مدير عشان يكتب إعفاء.
It's incredibly difficult for the staff here, with no funds and hardly any resources, deciding who lives and who dies. After much debate, the doctors tell us an exemption has been granted for Issa, and he will be moved into intensive care as soon as there's room. An exemption is also granted for the little girl, Imtiaz. But her grandma is then told there's no more functioning ventilators available in the ICU.
We cannot accept this case in intensive care unit because only 2 machines for 2 patients inside. Cannot take from the patient to do for this. What can I do? This is a big problem here in Yemen.
Al Sabine used to have 6 more ventilators for children.
1, 2, 3, 4, 5, 6.
None of them work.
Yeah, not work.
You don't have the funds or the parts?
Yes.
The Saudi blockade is crippling Yemen's health system. The lives of more than 4,000 kidney dialysis patients were at risk due to a lack of supplies. Médecins Sans Frontières stepped in, promising to air freight critically needed drugs and equipment for the next 6 months. But even they can't guarantee a steady supply of fuel for hospital generators.
The electricity has just gone off at this hospital, which means all these dialysis machines have stopped and the nurses are now frantically trying to restart them again.
The power kicks back in. The immediate crisis averted for these patients.